disabilities, those living with HIV, and ourselves. Remember, stay home, stay safe, save lives. The Ministry of Social Development and Family Services, helping, empowering, transforming lives. This Wednesday's topic, persons living with HIV and taking care, with Mrs. Maria Cruikshank-Gibbs, coordinator of the HIV unit, and Luke Sinnett, family service social worker. This is I 95.5's Who the Cap Fit.
Who the cap fit? Let them wear it.
Wise men speak because they have something to say. Fools because they have to say something. Plato.
Who the cap fit? Let them wear it.
Hello world. Hello world. This is www.i955fm.com, Trinidad.
This Sunday on episode 33 of An Dependency.
The nurses are humans.
That can be their greatest strength when it comes to patient care. It can also be their biggest vulnerability.
Hi, my name is Kristin. I'm an alcoholic, drug addict, and I'm also a nurse. I stole my drugs from the hospital where I worked, but my recovery is the real story. So join me this Sunday from 6:15 p.m. on An Dependency, as I will also speak about the dangers of drug diversion.
Following I on Dependency, tune in to T6 from 8 p.m. for episode 3, the I on Health series featuring Caroline Ravello, mental health advocate. Listen to I on Dependency live on I95.5 FM or watch live on the I on Dependency Facebook page or YouTube channel. I on Dependency, where every life is a biography. We don't just share stories. We change lives.
This is Eye on Dependency with Garth and Natasha. Sundays at 6:15 p.m. on the most influential name in radio, I95.5 FM.
Good evening and welcome to An Dependency. Welcome if you are listening on I95.5 FM, whether you're tuned in via Facebook or YouTube. Welcome.
Good evening, Trinidad and Tobago. Thank you very much for joining us one Sunday evening again as we start episode 33 of An Dependency. This evening is very important. Very important is because it's a topic that we wanted to touch for quite a while, and for varying reasons. Medical professionals are human, and we'll be really naive to think that drug use is on the street, away from hospitals, private medical institutions. Wherever there are drugs, there will be drug addicts. We've had stories of doctors, one ending fatally, with 2 doctors visiting a drug block. And what happened with that? As we are wont to do in this country, is that these things must come and go. However, as we said in the nurses are human, doctors are human. And in times of crisis or crises, sometimes people tend to lean on crutches to help them go through it. We have a pandemic on our hands. And did you ever stop to think or wonder how are nurses and doctors and medical care professionals dealing with this issue. It is real, and just like everywhere else in the world, it is happening here too as well. Fortunately, we have a nurse who we will speak with this evening. She'll join us via Facebook. She's out there in the US, and she had an experience that we want to share with you this evening.
Indeed. So before we invite her onto the program, we have a couple videos about Kristin Waite-Labott, who is the young lady we are going to interview. She's in Wisconsin, USA. We have a couple of videos, news items that she was featured on a couple of years ago, and I think that will put it into context in terms of the two major issues that we want to discuss with her, and that is her own personal addiction and how that developed, how her family treated with it, and the professional side of what she calls drug diversion. We'll learn a little bit about that. And basically that is when medical professionals divert drugs from their place of work, and the kind of consequences that has legally and otherwise.
Yes, we've had a story coming out of St. James Infirmary where drugs, some 25 million, that's a lot, folks. Mm-hmm. The police managed to recover 2.5, a drop in the bucket. If in case you missed that, well, we will show you what those drugs are. These were drugs for cancer patients. So we can thank the police for putting their hands on this drop in the bucket of drugs that has gone missing. Now, there are a number of reasons why these drugs go missing. It's called drug diversion. And it's a serious thing. And Kristin will touch on that. Kristin will touch on that too as well. Because, as I say, there are a number of reasons why drug diversion takes place. Either doctors take it to their private practice, or there are people who using drugs at the hospital and stealing the drugs. Because remember, there's an opioid crisis too. People tend to think that drugs just limited to alcohol, cocaine, marijuana, LSD, and all of these things. No, there's opioid crisis as well. We talk about fentanyl and other drugs. So it's a real situation, and it's something that we will take you through the steps this evening. And of course, Kristin will as well give advice to nurses if you run into this problem, what to do. So let's go to that first clip.
And then we'll go to a break and come back with the second clip, and we will meet Kristin Waite-Labott.
We are talking about the highly addictive drug, fentanyl. It's on the streets and it's taking a huge toll. The latest numbers from the Milwaukee County Medical Examiner Dino talked with a nurse who somehow managed to break free.
The woman I spoke with says she's extremely lucky her body didn't end up here at the medical examiner's office. Now, this building has been overloaded with fentanyl-related deaths, 30 in the first 3 months of this year, more than all of 2015.
Once I took it, I was physically craving it.
Former emergency room nurse Kristin Waite-Labott is talking about her crippling addiction to the narcotic fentanyl. It began after a routine surgery. First, she started using the prescribed painkillers, then morphine. Ultimately, she stole fentanyl from the hospital where she worked.
The minute I would walk into work, that urge or that craving would hit me, and I just could not say no to it.
Labott ended up getting caught and arrested. She spent 4 months in prison, where she vowed to get sober for her young children.
I thought my life was over, but really that's where my life started.
The fentanyl Labott was abusing is different from the fentanyl on the streets killing people now. Law enforcement say today's fentanyl is a powerful synthetic opiate, and especially deadly when mixed with other drugs like heroin.
It's called the Cadillac of narcotics.
Labott has been sober now for 11 years. She's even written a book to give people hope still struggling with addiction.
My message is to get help. You can't do it on your own. You're not meant to.
Now, Labott regained her nursing license and works in research. And because of the massive spikes in fentanyl-related deaths here in Milwaukee County, there are major changes underway that county leaders are taking. We're live at the medical examiner's office tonight. Kristin Waite-Labott, WISN 12 News.
We are talking about the highly addictive drug, fentanyl. It's on the streets and it's taking a huge toll. The latest numbers from the Milwaukee County Medical Examiner show that office is investigating 30 deaths connected to fentanyl. 13 of those are suspected cases still under investigation. We have big story coverage of this issue affecting communities throughout southeastern Wisconsin. Kristin Waite-Labott talked with a nurse who somehow managed to break free.
The woman I spoke with says she's extremely lucky her body didn't end up here at the medical examiner's office. Now, this building has been overloaded with fentanyl-related deaths, 30 in the first 3 months of this year, more than all of 2015.
Once I took it, I was physically craving it.
Former emergency room nurse Kristin Waite-Labott is talking about her crippling addiction to the narcotic fentanyl. It began after a routine surgery. First, she started using the prescribed painkillers, then morphine. Ultimately, she stole fentanyl from the hospital where she worked.
The minute I would walk into work, that urge or that craving would hit me and I just could not say no to it.
Labott ended up getting caught and arrested. She spent 4 months in prison where she vowed to get sober for her young children.
I thought my life was over, but really that's where my life started.
The fentanyl Labott was abusing is different from the fentanyl on the streets killing people now. Law enforcement say today's fentanyl is a powerful synthetic opiate and especially deadly when mixed with other drugs like heroin.
It's called the Cadillac of narcotics.
Labott has been sober now for 11 years. She's even written a book to give people hope still struggling with addiction.
My message is to get help. You can't do it on your own. You're not meant to.
Now, Labott regained her nursing license and works in research. And because of the massive spikes in fentanyl-related deaths here in Milwaukee County, there are major changes underway that county leaders are taking. We're live at the medical examiner's office tonight. Kristin Waite-Labott, WISN 12 News.
Hello, I am Jason Clark, better known as the Real Chairman. I will be a guest on Eye on Dependency TV series Eye on Health, every Sunday from 8:30 p.m. on TV6. For persons living with disabilities.
Slavery, a terrible time in our history. The kidnapping, buying and selling of people for profit, the exploitation of another human being. It still exists today. It has a new name: human trafficking. Anyone can be a victim. There is forced labor, sexual exploitation, and domestic servitude. Human trafficking is a worldwide problem and an emerging concern for us here in Trinidad and Tobago. If you know of or suspect human trafficking activity, call the Counter-Trafficking Hotline at 800-4CTU or 800-4288. Human trafficking is a crime. Identify it, report it, stop it. A message from the Counter-Trafficking Unit of the Ministry of National Security.
COVID-19 Conversations with PAHO.
Your first line of defense is the immune system of your body. Whenever a foreign body comes in like a virus, your own body will make antibodies to try and attack and shut that virus down. That's the first thing that happens. So the stronger your immune system is, the better. That's the whole premise on which vaccines are done. It introduces something into your body that will cause your immune system to generate those antibodies that will recognize a virus if it comes into your body.
Get the facts. Vaccinate, live. A message from the Pan American Health Organization, World Health Organization.
I'm Mava, and you listen to Eye on Dependency with Garth and Natasha on I-95.5 FM, Trinidad and Tobago. Don't be a fool and be a mule.
Thank you for staying with us. This is Eye on Dependency, and we are going to be speaking shortly with Kristin Waite-Labott, an unlikely addict. She's a nurse who diverted drugs from her workplace and has a story to tell. But before we cross to her, let's take in this video when she appeared on the television program The Doctors, which is seen here in Trinidad and Tobago, and they were talking about addicted healthcare workers, and Kristin was one of two nurses that they spoke to about this issue.
The following program contains mature subject matter. Viewer discretion is advised.
A silent drug abuse crisis is striking hospitals around the country, so today we're going to bring it to light. It's called drug diversion. Now, you might recall the TV show Nurse Jackie, in which Edie Falco plays that main character, a pill-popping addict who steals drugs from the hospital where she works. Well, get this. This isn't just a fictional plot line. Here are two real-life stories. Hospitals and healthcare facilities are hiding a dirty secret. It's called drug diversion, and in the worst cases, it's caused widespread disease outbreaks.
When I was working as a nurse, my drug of choice was opiate pain medications, mostly pills.
I work as a nurse in Wisconsin. When I was using, I diverted drugs from the hospital that I worked for. It didn't matter to me whether it was Percocet or Vicodin. The opiates were my preference.
It started because I had an old injury and I was going to a pain clinic.
I started taking drugs after a mild surgical procedure.
I was prescribed Vicodin and Norco.
I found myself complaining of back pain so that I could get more prescriptions from my doctor.
I was running out of my prescriptions, and that's kind of when it started.
It occurred to me one day that we throw away a lot of narcotics, and I decided to start taking them.
It started with small amounts. I would take a pill from a patient, or if there was waste left over, I would use that.
I really liked the drugs.
I liked the way it made me feel. After a while, it just became necessary.
The first time that I took that fentanyl, I had an immediate craving. It was at that point that I would steal it. Within minutes of being in the hospital, I would be in the drug cabinet taking it.
When I was at my worst, I would need medications to get out of bed. If I didn't have any, I would become sick and, just have withdrawal symptoms.
It got progressively worse to where I was taking it every time I was at work.
My addiction got to the point where I was calling in prescriptions with a doctor's ID for about a month before the pharmacy caught on.
I confessed to what I did, and I was very quickly fired. The police were brought in, was charged with like 26 felonies.
I was put in jail overnight. I was mortified. It was the worst moment of my life. That was my rock bottom.
I did get a job in a doctor's office, told him my whole story and gave me a chance. And to thank him for that, about a week after I started working there, I was calling in prescriptions for myself and under his name. I did that for about 3 months before they caught me. Again, I was arrested, charged with 9 felonies, and I spent about 4 months in jail.
After I was arrested, the board of nursing was notified and my license was placed on probation. I lost my job.
Amy and Kristin now join us, and I know this isn't easy to open up about. And yet I thank you for doing this. Kristin, I want to start with you because here you are working as a nurse, at this point in time stealing drugs. What happened after you were caught?
Well, once I was caught, I lost my job. They fired me. I lost my nursing license. And I decided to confess because I just couldn't take the guilt and the shame I was feeling. So they did end up charging me with 26 felonies. And I ended up with just a misdemeanor and some probation.
Amy, what about you? When you arrived at the pharmacy and police were there, what happened?
I remember arriving, seeing the officer at the counter talking to the pharmacist, and they were just nonchalantly talking, and thinking, he's not here for me, he's visiting his pharmacist friend.
it was pretty severe.
All right, thank you for staying with us. And if you're just joining us, you're listening to An Dependency right here on 95.5 FM. And for those of you who don't have access to Facebook, you can join us on our YouTube channel, An Dependency, because we're about to hook up with Kristin now, and so that she can take us through the steps of how she became addicted to fentanyl and what happened to her on her way on that trip. And again, if you're a nurse or you know a nurse listening who you know struggling with some form of addiction, alcohol, drugs, or whatever, I think you should let them know so that they can follow Kristin's story and see how they can get that help. So, short man, when you're ready, you could bring in Kristin if she's available. And of course, folks, at the same time too, we want to recognize, we just observed International Youth Day. So coming up, we're going to share the second and third first place winners again with you. If you missed it the last time, of the spoken word competition put on by the Counter Trafficking Unit and the Civilian Conservation Corps taking part. And also we have some condolences. Not a nice section, but we have to do what we have to do. Also, there's a Zoom meeting. This is an announcement on behalf of the Trinidad and Tobago Armed Forces Veterans Association. There's a Zoom meeting being held to assist all veterans, Dr. Rouse, and that Zoom meeting will be on Wednesday, 18 August 2021 at 15:45 hours. And they're having a session done by Dr. Jennifer Rouse. So we urge all veterans, and you know how to get on, so you have to check with the Trinidad and Tobago Armed Forces Veterans Association's page and get into that session, because it's very important for you, as Dr. Rouse will be sharing some vital information, of course, for you. And this coming from the president of the Trinidad and Tobago Armed Forces Veterans Association, Mr. Melan Garcia, who sent this information to us. There's also a Zoom, every Wednesday there's a Zoom forum, open forum to all members of the Trinidad and Tobago Defense Force. All are invited. And again, you can check with the members of the Trinidad and Tobago Armed Forces Veterans Association to get more information on that. And you'll hear more about that before we close on. Right, she's here with us now, finally. Kristin is here with us, folks. In Wisconsin, and she's going to be taking us through her journey here this evening, and with the idea that it will help some of you out there who's struggling and struggle the way she did. Kristin,
good evening.
Welcome.
Welcome.
Hello, Natasha and Garth. Thank you so much for having me on your show tonight.
Right, so you can speak up a bit, Kristin. I'm sure maybe you can put up a volume so the radio listeners as well can hear you loud and clear. And again, for those of you who can't join us on Facebook, you can do so via YouTube, An Dependency YouTube channel. Right, Kristin, let's try again. Good evening.
Good evening. Is that better?
Yes, much better.
It is.
Great.
Thank you, and thank you very much for taking the time out to speak with us here this evening. So, Kristin, take us through this journey.
Start by telling us, for those who missed the introductory videos, tell us briefly about how you became addicted to opioids.
So I started my opioid journey after a minor surgical procedure in 1997. Now, I had always had an affinity for alcohol. I liked alcohol, started with alcohol in college, and didn't really drink like my peers, drank more, and found that I really liked it. It made me feel much more comfortable in my skin, gave me courage. I was socially shy, and it just gave me courage and helped me to get through those awkward kind of situations. Made me feel like I fit in. But of course, with alcohol, you act silly and you smell bad, and you don't always make good decisions. So after that surgical procedure, I was prescribed Percocet, which is a strong opioid, and found that I really liked the effects of the Percocet. I liked how it made me feel. And in addition to that, it made me feel similar to alcohol, the effects that I got from alcohol, but I didn't act silly. I didn't didn't smell bad, didn't slur my words, things like that. People wouldn't necessarily know I was taking it, but it would still make me feel better than I did without it. So I took that first prescription, called in for a refill, even though the surgical pain was fine, and took all of that prescription, over the course of maybe a week or so. After that, over the next few years, I would take it periodically. So my husband, dating him during the surgery, but then later did marry him. So my first husband was a carpenter, and he would injure himself sometimes. And he'd end up in the emergency room, and they would always give him something for the pain, whether it was oxycodone, Percocet, and he would share that with me. And he drank plenty too, so it was kind of something we did together. But even when he didn't need or didn't take his pain medication, if it was in the cupboard, I would sneak it and not tell him. I remember one time I called in a prescription for him on his refill, or on his prescription, that he didn't need or want and didn't even know I did, and took all of his refill. So I did stuff like that, and then I was working in an emergency room in a hospital, and we certainly waste a fair amount of narcotics or opioids in the emergency room. And one day I just put it in my pocket instead of wasting it with another nurse. I asked the nurse to sign off on the medication for me as though she had seen me waste it, which she did without question. And I later went home and took that, and it was an IV medication. I don't remember exactly what it was, but probably morphine or something along those lines. That went on for a couple of years, just taking when I had extra. So if a patient, they come in 10 milligram syringes, morphine does. And if the patient only needed 2 milligrams, I would take the extra 8 milligrams. If there was a medication that expired, I would take that instead of wasting it or throwing it away. I would take that, all those kinds of things. And then I transferred to a different department in the hospital where it was a transport position, and we went to other hospitals and brought patients back to our hospital for specialized care. And during some of those transports, we used the drug fentanyl, which, as you may know, is a very strong narcotic and very addictive. And certainly all opioids are addictive, hence the problem that we're having right now. But fentanyl is particularly addictive. It's a synthetic opioid, meaning that it's completely manufactured in a lab, and it's much stronger, 50 times or so stronger than morphine. So you only need a very little bit. It's measured in micrograms instead of milligrams. You only need a very little bit to get the same effect. So I had leftover fentanyl after one of my transport patients and took that home that evening. And I remember after taking that drug feeling quite a rush, way different and more intense than anything I had before, and instantly craved more of it. And I hadn't had that experience before. I certainly always wanted more drugs. So don't get me wrong where I say I didn't think I was addicted before the fentanyl. I certainly was. But it wasn't at a point where, I know it's a funny distinction, but in my mind at the time I wasn't stealing it because I was just taking garbage or waste medication. Of course I was stealing it, but in my mind I wasn't stealing it. I only took what was left over. But when I first tried that fentanyl, I started stealing it from the stock. I was also going through a divorce from my first husband at the time, and I was very emotionally distraught. So I think that played into it as well. I was looking for comfort for that. And that fentanyl was just so strong and took all that pain away. It took all that anxiety and fear, it took all of that away. And so I started stealing it and really seeking it out. Previously, if I hadn't had any waste medication, I didn't take anything. I was sad about that, but I didn't take it. Once I started with fentanyl, I was taking it practically every time I worked. And it didn't take them too long, although fairly long, about 9 months, I think it was, at least that's my estimation, before they caught me doing that. And so once they caught me, I was pulled into a conference room when I arrived at work one evening, and my manager took me into a conference room, and there was a sheriff's deputy there, a detective, the head of security, the head of pharmacy, the head of nursing, all very important people. And I knew immediately what was going on. I knew that they had discovered what was happening. And I sat down and denied everything because I had such fear. I didn't know what to expect. I didn't know what to say. And they let me go home. But sometime later, I had gotten a lawyer, and I decided that I needed to confess everything because I couldn't live with it. I couldn't live with just that guilt that I had done what I did, and everyone knew. It was obvious that it was me. So I called the detective that had been there in that meeting and confessed everything. And I ended up getting charged with 26 felonies, 2 for every vial of fentanyl that they, or ampule they were, of fentanyl that they could prove I stole. And I did end up with 1 misdemeanor once all the court stuff was done. However, after that, I had lost my nursing license then as well. So
Kristin?
Yes, sorry.
Right, that's all right. Could you be, if you're just joining us, folks, you're listening to An Dependency, and we are speaking with Nurse Kristin Waite-Labott out there in Wisconsin, and she's telling us how she became addicted to fentanyl. She now has to account for what she did, and it gets better. If you're just joining us, if you cannot join us on Facebook, please join us on YouTube channel on An Dependency, or you listen to us on I-95.5. We're going to take a quick break, and when we return, we will continue with Kristin's story. Stay right there.
This is reality radio at its best. I on Dependency on I-95.5 FM.
COVID-19 Conversations with PAHO.
WHO is a public health agency, a global public health agency that we're part of. So they advise, we talk glibly about, wearing a mask, washing your hands and all the rest of it, keeping your physical distance, and if, how COVID-19 is spread, the fact that it's a virus, it's not bacteria, all of that sort of thing. That is because we have the knowledge and evidence, and we are the ones that put together those guidelines.
Get the facts. Vaccinate, live. A message from the Pan American Health Organization, World Health Organization.
Hola, my name is Elena. Well, it's actually not my real name. You don't really care, do you? All you care about is want to pay your money to my boss that I look pretty, smell nice, smile for you, and let you have good time, enjoying yourself and doing to me whatever you want to do for the money you paid. What you don't see or know is that I don't get any part of the money you paid. My boss takes all of it. I am forced to work, taking as many clients as my boss tells me to. I am beaten, made to take drugs, and I cannot leave this kind of work on my own. I am a victim of human trafficking. Please, por favor, help me.
Hello, I am Jason Clark, better known as the real chairman. I will be a guest on Eye on Dependency TV series Eye on Health every Sunday from 8:30 p.m. on TV6. Don't miss this important series, as I will be speaking about inclusion and advocacy for persons living with disabilities.
Hello, my name is Raquel, a trainee inmate at HMP Drake Hall, Staffordshire, England, and you're listening to Eye on Dependency with Garth and Natasha. Please, people, don't traffic drugs. The money is all that nice. It's not worth it.
Thank you for staying with us, and we are speaking with Kristin Waite-Labott out there in Wisconsin, and she's telling us about her journey with addiction. Alcoholic, drug addict, she lost her license. So, Kristin, welcome back.
Hi, thank you.
Right.
So
yes, and so you got to the part where you saw the detectives, and she just the back announcer before those who just joining us. So you got to the part where you saw the detectives at the hospital, you call the detective, and you take us from there.
Yes. So as I said, I confessed to everything that happened because I just had an overwhelming sense of guilt. And once I confessed, I was charged with 26 felonies and lost my nursing license, as should have happened. Obviously, when you're caught doing something like this, they don't want you working with patients. So I lost my nursing license. And this all happened in July of 2004. And by October of that year, the court process had worked its way out. And sorry, got a little distracted there. And I ended up with one misdemeanor. So they just gave me probation and I didn't have to serve any jail time at that time, and I felt a big relief. I went to work as a secretary in a doctor's office and was so grateful for that job because that doctor was very kind to give me an opportunity after I had done what I did at the hospital. And not too long after starting to work there, I began calling in prescriptions for myself under his name. He gave me a prescription for a patient for Vicodin and asked me if I would call that in. And I called that in for the patient and realized how easy that was. And so I went into the other room not too long after that and called in a prescription for myself. And so I started doing that on a fairly regular basis in October of that year, 2004. And by January of 2005, they had caught me doing that. So while I was on my way to the pharmacy to pick up a prescription, and as I was driving to that pharmacy, really praying and asking for help because I did not want to do it. Every time I took the fentanyl at the hospital, every time I went to pick up a prescription, I didn't want to do it. I felt terrible about it. I knew I was doing something wrong, and I wanted to stop it, and I couldn't. So I got to the pharmacy, and as I tried to pick up the prescription, the police pulled up and arrested me. I didn't leave jail for 4 months then, and was charged with 9 felonies that time. And one of them stuck, so I'm a felon today and will always be. And that's pretty much how I started and ended my opioid use, because after getting out of jail, so I was arrested on January 18th, 2005, and I was there until May 13th of 2005, so 4 months. And once I got out, I decided that was it. I didn't want to use substances anymore. I wanted to be sober. So I threw myself really into recovery, and that's where that journey began. After that.
So Kristin, you say it's prison that woke you, that finally gave you a wake-up call.
Definitely. I knew that I did not want to go back there. I didn't like being there. I didn't like being separated from my children. I have 2 daughters. And it really was what it took for me to say, I think 2 things. First of all, it was painful enough that to be separated from my children and my family and really the world, painful enough that I didn't want to go through that again, but also long enough to keep me away from substances so that my head could clear and I could think rationally. Because before, whenever I would get stressed or feel anxious, I would get something, whether it was alcohol or drugs. And I don't remember a time really in my adult life that I didn't do that. So being in jail, as awful as it was an opportunity for those substances to clear out of my system so that I could really, I think for the first time in my adult life, make some rational, positive decisions about the course of my life.
No.
So how did the addiction itself plus the added trauma of being arrested and being in prison, how did that affect your family and your children?
Certainly was very difficult on all of them. My parents and my sister in particular, and then of course mostly my daughters. My parents were understandably very upset. They were supportive, but they were very upset. Nobody had any inkling that I was taking any kind of drugs. And so it was very shocking to them and overwhelming. They did come to visit me while I was incarcerated, and my older daughter as well. So my oldest daughter was 14 when I was there, and my younger daughter was 4. And my younger daughter I didn't see for the whole time that I was there. But my older daughter came to visit me a few times. She was very understandably very upset, angry. And when I did finally get out, my younger daughter just missed me and was glad I was home. But my older daughter was a little bit more difficult. She didn't understand certainly why I would do all those things and leave them. And it took her much longer to forgive me and let me back in and trust me. I remember that first night I was home, I wanted to go sleep downstairs where I would usually sleep. And she said, no, please sleep up here with me. I don't want you to be out of my sight. She thought that I was going to either go drink or use drugs again. It took her a long time to get over that. In fact, I imagine sometimes she still, 16 years later, has some worry sometimes.
No, Kristin,
yeah.
This is a good point we could elaborate on here. And for families that are listening, that when addicts return from rehabilitation, they tend to think that parents or family should trust them immediately. And you can attest to the fact that it doesn't happen like that, correct?
Correct. No. She certainly expected me to be exactly the way I was when I went away. And the first time I got in trouble, nobody knew I was on drugs. Second time I was in trouble, they didn't know I was using drugs, but I was drinking alcohol and I was not supposed to be. So she just expected that same kind of sneaky behavior. And I had to prove to her that I was different, that things were different. And that took a long time. I worked very hard on my recovery. I went to a lot of meetings. I went to counseling. I went to group therapy. I did all of that. And it took months, probably a year, before she could start to trust me at least a little bit.
But you understood why, right?
Yes, I did. Only because they told me that in counseling. Like they were very open about that you have to give your family and your friends and those who love it trusted you once and then you lost that trust. You need to give them time to that. Give them time to see that you're doing what you're supposed to be doing.
Now, were there any stipulations, any restrictions like what they expect of you to be with regard to finance and being out at a certain time, and they expect you to be, what was that like?
In jail or once I was...
No, once you're back home with your family, there are certain freedom that you would have had as before, but now after coming and going in for treatment and all of that, were you expected to operate a certain way for a certain amount of time so that they can maintain their trust? So like going out and staying out late?
I was on probation for 3 years.
Say that again?
Yeah, I wasn't allowed to do any of that.
Right.
I wasn't allowed to do any of that. Looks like I'm frozen.
Just now, we're losing
Can
you
you
a
hear
bit.
me?
We're losing you a bit.
Can you hear me okay? Okay. Is
Yes.
it any better?
It's getting better.
Isn't it better?
No, it's getting kind of shaky now.
People will just give it a second. When you Okay, I can see in my picture that I'm a little pixelated.
Yeah.
Yeah. If you're just joining us, you're listening to
speak now?
An Dependency, and we are speaking with Nurse Kristin Waite-Labott out there in Wisconsin, and she's taking us on a journey of her drug addiction, fentanyl addiction, alcohol addiction, and the likes. Von Martin, good evening to you from out there in Washington, D.C. Anya Knights and Diane and Suzanne and Bianca, everybody welcome. Let's try you again, Kristin.
Can you hear me okay now?
Yes.
Much better.
Much better.
You
Right.
can hear me better?
Yes. So, yes. And you understood that you had to conform, you had to regain their trust. It wasn't like you demanded that they trust you because now you're clean up and all of that, right? It didn't work like that.
Right. I understood because my counselors told me they helped us as a family to understand that was going to take some time to mend that relationship.
Right.
So I accepted that and was patient with my family. And they were very patient with me as well. But it was a journey. It wasn't something that happened overnight.
Right. And how do you maintain your sobriety today? Are there things new habits that you've developed?
Most definitely. I think the most important thing I do is maintain an active 12-step or support group. I go to Alcoholics Anonymous and a couple meetings a week, and I will do that, I believe, for as long as I want to be sober. But then I also work with other alcoholics and addicts, some nurses, some not nurses. And I do that because it gives my story some meaning if I can help somebody else through that process. It was very difficult working to get my nursing license back and knowing the steps to take to do that. It took a couple of years, understandably, and lots of hoops I had to jump through to get it back, but I was more than willing to do that. The problem was I didn't know, really didn't show me how. And so part of the things, or part of the most meaningful thing that I do now is to help nurses that are new to recovery kind of navigate all of that territory of how to get their license back, how to work with their family, how to work with their employer, and themselves too, really, to be sober. But it takes work to be really in recovery, not just sober, but really in recovery. And a big part of that is taking care of ourselves, because I certainly never did that before. So I find things that I love to do. Kayaking is one of them. I love to spend time on the water and really focus on taking care of myself so that I'm strong enough to help others.
Now, we're in the middle of a pandemic worldwide, and nurses all over are really under the gun, medical professionals, frontline workers. We hear of that daily. What is it like in your neck of the woods with regard to that, and how nurses dealing with this pandemic with regard to their substance use and or staying away from substance use? How are they coping with it?
Well, as I'm sure it has been by you, it has been overwhelming, the pandemic. And nurses in particular are feeling the strain. I work in behavioral health now, so it hasn't been terribly bad as far as working with COVID patients. But I know I have a lot of nurse friends, and a lot of them have, and are feeling that burnout, that overwhelming, working too much, too long, and under very stressful conditions. And we're seeing this resurgence with the Delta variant now, and nurses are having almost a PTSD or a post-traumatic stress disorder response to this uptick in admissions now for COVID again, because kind of we thought we were through the worst of it, and now it's almost like it's happening again. So it has been a very stressful time on nurses, and they're reporting roughly a 30% increase in diversion, substance use, among people, nurses, all over. And it's just an estimate because there's really no way to know who is all using and who is, diverting. But that's their best guess, which is a huge number. So in Wisconsin, we have about 80,000 nurses. The American Nurses Association says about 10% of nurses have some form of substance use disorder. And if we use that number, considering the 80,000 nurses in Wisconsin, that's 8,000 nurses suffering from some form of substance use disorder. And if we increase that by 30%, that's an unbelievable amount it's almost half. That would be 40%, right? 10 plus 30. Just an overwhelming number to think about.
It is, and how do nurses on a whole, or what is in place to allow nurses to approach their colleagues if they suspect? Because I'm sure when you were using, nobody suspected that you were. So how can nurses or colleagues intervene in each other's lives in that way, in such a high pressure, environment?
So you're right to say when I was using, nobody had any idea that it was going on. I hid it very well, but there were definitely signs that would have allowed my peers to know that was happening. Some of those signs are things like falling asleep during a shift when it's not normal for a person to do so. So we've all heard of that opioid nod, possibly, where you just can't keep your head up or can't keep your eyes open. So that's a great indicator, certainly, of substance use. But that's kind of an advanced sign. More subtle signs are taking frequent breaks. So a nurse, maybe all of a sudden you notice that they're going on a break every hour or every 2 hours, going to the bathroom and staying there for an extended period of time, where all of a sudden you can't find them, and that's repeated. Increasing irritability. So someone who is a really friendly, outgoing person, such as myself, most of the time anyway, suddenly becomes irritable and snips at you, or becomes short with patients. A personality change like that is a really good indicator as well. And certainly a combination of things is something also to look for. So if you know a peer of yours had surgery a couple of months ago, and now you're starting to see them come to work with bloodshot eyes or circles under their eyes and looking very unkempt, where they used to be very particular about their appearance, where people maybe are calling in sick to work or stumbling around. Those who drink alcohol and come to work may be stumbling or may smell bad. All those subtle, sometimes kind of signs taken together. Also someone possibly who has gone through a very emotional time. Like for me, it was my divorce that really escalated my using. Divorce, maybe the loss of a loved one, things like that can really trigger it as well. So if you notice that, a peer had something like that happen, and now you're noticing frequent bathroom breaks, irritability, unkempt appearance, certainly you would want to think that obviously they maybe need some help. Whether or not they're using substances, they still would need some help. And the best thing that you can do for them is to assist them in getting that help, which can be tricky, most certainly. We know, I'm sure most know, that those who use substances are not real open about that. It's a difficult thing to talk about. It's a scary thing to talk about. So confronting them with that is probably not the best approach, but just letting them know that you see changes in them and that you're very worried about them. In my state, in Wisconsin, we have to report unmistakable signs of substance use in our coworkers. Based on our license, we must report that. So if you, as a nurse, certainly have real concerns about a colleague, you might want to talk to your manager or supervisor about them. And you don't have to, say, I think they're using drugs, but take your concerns to management and say, I'm really worried about Sally Mae. She, I know she went through that divorce last year, and lately she's been taking a lot of breaks. She is very irritable, even with the patients, and she's just not herself, and I'm really worried about her. I've talked to her about it, but maybe you could talk to her about it too. So I think also knowing those signs to look for before you see them is important, because I think had my peers known those signs, they might have said something to me, or at least to my manager, before it got to the point that it did.
If you're just joining us, you're listening to An Dependency, and we are speaking with Nurse Kristin Waite-Labott out there in Wisconsin. She's taking us through her journey of addiction and recovery. And we're going to take a break, Kristin, and when we return, we give you a chance to switch that device. However, I want to talk, before we move on, I want to talk about doctors as well, because doctors are under the same kind of pressure. What do we expect to see from them, and how do they deal with doctors in your neck of the woods? So if you all stay with us, we're going to take this quick break and return with Kristin right here on I-95.5 FM, on Facebook Live or YouTube, An Dependency YouTube channel. We'll be back.
Eye on Dependency. Eye on Dependency, where every life is a biography. On the Eye, 95.5, the most influential name in radio.
Boy. I feel I'm gonna buy myself a señorita tonight.
Nah. You might be promoting slavery.
Slavery? Mm-hmm. What are you talking about?
Hey, modern day slavery or human trafficking is just what some of these people just do. Some of these women were tricked to come here. Some are held against their will, abused, and even beaten. Most times the girls don't even see any of the money that is paid for them. And every night, they just have to come out looking nice and sexy for somebody like you. Human trafficking is a serious problem and a serious crime. Persons who solicit commercial sex services may be contributing to human trafficking. A message from the Counter-Trafficking Unit of the Ministry of National Security.
Coming soon to TV6, the Eye on Dependency TV series, Eye on Health. Starting on August 1st, you will learn about NCDs from survivors and experts. Eye on Health, Sundays at 8:30 p.m. and only on TV6.
COVID-19 Conversations with PAHO.
Because we're going to be vaccinating a small portion to begin with, every country, we are going to be having vaccines for about 20% of the country to begin with. means 80% will not get vaccinated immediately. So still, the vaccine is not going to be a magic shot that is suddenly going to allow us to shut everything else down and have carnival. No, that's not going to happen. Not right away. It's going to take time. It's going to be a phased approach. After one set of priority people, we'll have to look at the next set. So all of that the ministries are working out.
Get the facts. Vaccinate, live. A message from the Pan American Health Organization, World Health Organization.
Hi, I'm Danielle and you're listening to Eye on Dependency, where every life is a biography, Trinidad and Tobago. Don't traffic drugs, it's not worth it.
Thank you for staying with us. This is Eye on Dependency, and we're talking with Kristin Waite-Labott. She's a nurse out in Wisconsin with an addiction to opioids, and how she's sharing her story of addiction and recovery, and also how professionals like her, nurses, can deal with addiction issues in the workplace. And Kristin, if you're hearing us, we have a question from the audience before we go to that CCC video.
Are you hearing us, Kristin?
Yes, I hear you. Can you hear me?
Okay.
Can you hear me okay?
While we are getting Kristin situated, Garth mentioned earlier that we wanted to share the videos, the second and first place videos of the CCC spoken word competition on human trafficking awareness. And we want to share with you now the second place video from Central Region of Civilian Conservation Corps.
Yes, folks, they received their prizes this week, and we just want to share that quick before we come back to Kristin while Shortman sorts out the issue, the connection. So let's go to that video. Shortman, let's play the second place winner of the spoken word competition in case you missed it last week. This is from the Central Region of Civilian Conservation Corps. And once again, we'd like to thank the IOM and all of those folks who contributed to the prizes for the trainees. It was, thank you, well received by the trainees. As I said, Ms. Wheeler presented them with their prizes last Friday. And the Ministry of National Security Counter-Trafficking Unit acknowledged the top 3 contestants of the virtual spoken word competition at the brief handover ceremony. Sorry, that was on Wednesday, 11th August 2021 at the office. The competition, which was only open to members of the Civilian Conservation Corps, was part of the CTU's Human Trafficking Awareness Week held during the period 23 to 30 July. Under the theme From Awareness to Action, the spoken word competitors were invited to submit a creative piece via video on one of 3 topics, including Real Men Don't Buy Women and Girls, Humans Are Not For Sale, or Break the Silence, Break the Change. And the first place was awarded to Miss Akela Cooper from the CCC South Central Region. Second place went to Journey Macmillan with her team, and Miss Danielle and Miss Braffett, Miss McHale, Guy, and all the others, they were from Central Region, and Jada Ryan, also from CCC Central Region, placed 3rd in the competition. And again, we'd like to thank all of them who participated and folks who contributed to the prize structure. They won iPhone and iPads, and it was well received, trust me, and also $500 vouchers for Pennywise for those who appeared in the second place with the team. And we thank the Franciscan community for donating those vouchers. All right, so Shortman, before we come back to Kristin, let's play that video quick so that people can see the second place winner, and then you could take your time and sort Kristin out. And if you're just joining us, you're listening to An Dependency, and we are live on I-95.5 FM, live on our Facebook page, An Dependency, or YouTube channel, An Dependency. So,
what do we?
Can you hear me now?
As you know, folks, from time to time, what happens, especially when it rains, what goes on with, I mean, that shouldn't affect internet, but somehow it does in Trinidad and Tobago. That's something that we continue to grapple with. I'm hoping that one day we don't have to be asking the question, can you hear me now? That I don't even play on radio again, on TV anymore. But for some reason, we still have to ask the question here, can you hear me now? Can you hear me now? I don't know why. So, Kristin, are you there? Can you hear us?
Yes, I can hear you. Can you hear me?
Yes. Much better too.
Yay!
Yes, and you can, just raise your volume a bit so we could continue with our discussion, and we'll get to that that video with the CCC
later. Because I wanted to ask a question from a member of our audience on Facebook who is asking if there are any cases that you're aware of where co-workers introduce drugs to their colleagues, or is it merely an opportunity for some persons who are addicted to have access to stronger drugs?
Yeah, and that's a good question, Kristin, because sometimes, you will see somebody struggling to cope, and then you say somebody will offer them an opioid. Look, try this. This will help you go through the night. Yes, good question. Go ahead.
Yes, that's an excellent question. Yes, that absolutely does happen. Even though we're supposed to be smarter about how addictive these drugs are, I have had people offer me, even being in recovery, offering me something. When I said, oh man, I have such a headache. Oh, here, I have some Vicodin. Do you want one? I don't understand that. It always really surprises me when I hear that happening, but it certainly happens. I think most of the time it is just opportunity. Going through a stressful event and being around all of these very potent medications and knowing what they do. Certainly for some, like me, makes them too hard to pass up. But there certainly are others that introduce, for sure.
Yes, there was another question related to that in terms of, and I think Bianca was asking whether, how do you know when a prescribed drug, or if a prescribed drug can be addictive? I'm assuming that we know this before it's prescribed, but how would an ordinary person know whether a prescribed drug is addictive or not?
That's a really good question. You should have a conversation with your doctor, whoever is prescribing, or provider, if it's a nurse practitioner, about any medication that you're being prescribed, and have that conversation with them. Medications that are mind altering, so things like opioids, Valium, Ativan, those kind of things for anxiety, Xanax, those kind of medications are addictive. If you're not sure, you can also Google it. You can Google medications like, is Vicodin addictive? Is Xanax addictive? Or is ibuprofen addictive? Google isn't probably the best medical advice in the world, but it certainly will give you an idea of what to watch for and which medications. In the United States, I'm not sure if it's the same in Trinidad and Tobago, but in the United States, we have scheduled medications. So the government has determined which medications have a higher potential for abuse and addiction, and then they give them a schedule number. And so you can look them up too, what schedule is Vicodin, and it will tell you it's a Schedule 2.
Now, Kristin, there's so many questions that we have to ask you, right? Because it's an ongoing problem around the world. Let's touch on senior citizens. Can they become addicted to opioids as well, especially painkillers? People who...
Absolutely.
Yes, tell us about that.
Yeah, so I mean, in fact, it's a very concerning population because they don't understand how strong they are always. And so not only are they becoming addicted, but they're overdosing at a much higher rate and even getting injured because they can make you kind of dizzy and feel loopy. And, you know, elderly folks don't have the best balance to begin with. So they can lead to falls and other kinds of injuries as well. So very definitely need to be aware, you know, if you are caring for elderly folks, and particularly cancer patients are very often prescribed fentanyl patches. In fact, my mother, 2.5 years ago, she passed away from cancer and was on a fentanyl patch and had a fall because of it. They're just very dangerous in the elderly, and you know they affect them more readily as well.
Right. Now, advice for young ones coming in, so young nurses entering the field. Oh, before that, I wanted to find out about doctors. Doctors in your neck of the woods, have they too been caught wanting with regard to substance abuse?
And how is the treatment different in terms of how doctors and nurses not only divert drugs but sent for treatment or for help, or removed from their or have their licenses revoked?
Yeah, so doctors fall victim to substance use at about the same rate as nurses, but their course of treatment is very different. Typically, when a nurse is caught diverting medications, their license is suspended and sometimes revoked. Physician's license, usually they keep their license and are sent to treatment. So nurses often lose their jobs. Physicians will keep their jobs but be granted a leave. So they still retain their income, they retain their insurance. And a nurse oftentimes will lose both of those, their job and their insurance, which makes it then very difficult to get treatment. So it certainly favors physicians in that regard. And I'm not suggesting they shouldn't be. I think that is great that they can be supported through their treatment. I just wish that the same was given to nurses. And I think that actually is getting a little bit better. The new nurses that I hear coming into our programs are still employed and were given a leave of absence. And so they were able to retain their jobs and their insurance. So that's very encouraging. I think that that's getting better. We still have a ways to go, however, but better.
What should these new nurses know about drug diversion when they're now entering the workplace?
Yeah, I think it's really important for new nurses and student nurses to learn what drug diversion is, and that anywhere really that opioids are prescribed or are present, there is diversion because they're so addictive. And so I think new nurses and student nurses should be taught what to look for, taught how to intervene if they see it, but then also what signs in themselves to look for and what to do if they find themselves falling victim or using substances to cope with the stressors in their lives, whether it be work stressors or life stressors. But those signs to look for in themselves that they need to then reach out for help before it becomes a diversion incident. But, you know, if they can look at, like, for instance, my history and see that I used alcohol way before I used drugs to help me cope with life. You know, if they find themselves as a student nurse using alcohol to get through exams and to get through the stress of a new semester starting, get through the stress of having to take chemistry. Chemistry was so hard. Maybe they can then say, gosh, I better see somebody about this because I don't want to end up, in bigger trouble down the road. So we could intervene sooner by maybe knowing some of those symptoms and those things to look for. I think that's just really important.
Now, we speak in drug diversion, and Shobha, can put up the picture of those drugs, those cancer drugs that the police found that was stolen from the St. James Infirmary. And we have to remember as well, folks, post-social media, pre-social media, what happened in Trinidad stayed in Trinidad. But with social media, now the world knows what happens here. Some drugs you heard were reported stolen from the St. James Infirmary. And
millions of dollars worth.
Millions of dollars worth. Some 25 million. Now that's a lot of drugs, right, Kristin?
Yes, that's a lot of drugs.
Right. Now,
definitely.
Now on your screen here now, I apologize to the radio audience, but on screen here now, you will see the drugs, some of the drugs that the police found. That they said these were for cancer patients. How dangerous is drug diversion, Kristin?
Well, it's very dangerous for many reasons. In my drug diversion, I was stealing opioids from the hospital. That too is drug diversion. I'm stealing them for my own personal use. That's very common. I don't know how very common, but it's quite common. But then there's also drug diversion where you're stealing drugs for profit. And I think that's most likely what happened in this case, is that they saw an opportunity to take these drugs and make some money. A lot of money, as you said, they're worth, $25 million. The problem is, of course, then they're being, number one, not kept in the correct, maybe temperature. They're not, if they're refrigerated medications, they're not kept at a refrigerator. So they're not handled properly. At least that would be the concern. And certainly when they're selling them to whomever it is they sell them to, if people are trying to get them to treat cancer, or even one of those drugs I saw in that list could have been used to treat COVID. If they're using those without a proper doctor to prescribe them and administer them, they could have side effects, they could have reactions to those drugs. How do they know they're getting the right dose and the right frequency? Are they getting it administered correctly? Is it an injection? Is it an IV medication? Are they mixing it correctly? A lot of those medications have to be mixed very precisely under very strict conditions. Are they keeping it sterilized so that it's not introducing bacteria? All kinds of issues that go along with getting drugs outside of the hospital or pharmacy, where they know how to take care of them and they know how to administer them.
Right. So that's for one. That's for one reason that, or there are several reasons that drug diversion takes place. So we have the ones that will be stolen to taken to private
for personal use.
For personal use. Then the ones that will be taken to private practice
for profit.
For profit.
That's
correct?
Right. Yes, that's right. Yes.
And
Can you hear me?
Dangers, I guess, the dangers to person and persons for both reasons. It's dangerous because you don't know if you are on the receiving end of these diverted drugs that are being sold to you, not from a hospital, but from a random person. You don't know, as Kristin was saying, whether it's being kept at the right temperature, whether it's being administered properly, whether it has been tampered with. All of these things are, of course, risks to anyone who is taking this medication. So
and then now we would have patients who go to get prescriptions filled. They would be turned away because these drugs are not there.
Available at the hospital, yes.
Right. Right,
Now,
that's the...
Now, if that happens in your neck of the woods, what recourse does a patient have, or patients have?
So if a patient were to go to the hospital and not, I mean, they would just, I suppose, go to another hospital. But if that medication isn't available and they have to go to another hospital, they may be going to an out-of-network provider where they would have to pay for that visit themselves, that their insurance maybe wouldn't cover it. Certainly if the patient is going to somebody other than their provider and getting the medications outside of them, the risks are many, and they have no recourse then. If they, if they're given the wrong drug or the wrong dose, or it's administered incorrectly, if they're not getting that through their physician, there is no recourse. They're on their own, and taking, a big risk.
Right.
A big.
If you're just joining us, folks, you're listening to An Dependency, and we are speaking with Ms. Kristin Waite-Labott out there in Wisconsin, and she was just giving us a brief history of her journey with addiction and drug diversion at the hospital where she works. And you got back your license, thank God, and you are now continuing with your profession. And how was the relationship with your family and all of that? Before we go on to what would you say to other nurses? Has the relationship improved with your family as well?
Yes, I'm happy to say that those relationships have been mended, and I'm very close with my daughters. My mother did pass away 2.5 years ago, but we had mended that relationship, and we were very close, and I was able to take care of her when she was sick and help her through that, which was very meaningful to me. My dad and I have a great relationship. We travel together often, and really our relationships are better than they were before. Only because I think I'm really working my recovery program, and I'm worked hard at fixing those things in myself that I needed to, so that I could be more available to my family, especially my children. And that's the best part about the whole recovery journey, is having my children again look up to me rather than be so angry and hurt. And I feel like I got sober at the right time for them. They both have done well in their lives. My older daughter is married and just had my first grandson, so he's just turned 5 months old.
Congrats.
Which is a delight. Thank you. And she actually wanted me to come and help her when she had him, and I got to stay with them for about a month and help her with the baby, and it was wonderful. None of that would have happened had I not gotten sober, so very, very grateful for that.
Do you ever get cravings?
I do not. The only thing I miss really is the camaraderie that I used to feel when I was younger and we would go out and, party, so to speak, and have a good time. I miss that, but not what comes after it. I don't miss any of the drug stuff. Jail really cured me of that. I think it was painful enough that I have no desire for drugs or alcohol. I don't want to go back to that life anymore.
I have one question before we begin to wrap up. Is there one thing that you would have, or what is the one thing that you've learned about your profession that you love so much throughout this journey?
That nobody wants to talk about this issue of drug diversion. I think like I said before, I think it occurs wherever there are opioids in the hospital or in the clinic or the pharmacy. It's happening everywhere, and we need to start talking about it so that we can fix the problem. Because if we continue the secrecy around it, we're not going to be able to fix it. And I think those of us in recovery really badly want to fix it. It's just difficult to talk about. As you can imagine, it's not. I talk about it often, so it's it gets better and easier each time I do. But there aren't a lot of people who want to share those details of their life, of the things that they did that are so shameful.
Now, what would
But
you
I
say?
think
Now, what would you say to nurses who are struggling with addiction in silence? What advice would you give to them?
speak up, get help. It does not go away by itself. It does not get better without intervention. You need help. We aren't meant to get better by ourselves. We need each other, and there are so many of us in recovery that are willing to help. So look me up on Facebook, send me a message. I'm more than happy to talk and send folks in the right direction. But you have to ask for help. It's not going to get better by itself.
Correct.
You don't have to suffer
alone. And you did write a book, and you have a website. Tell us about that process of why did you decide to write a book, and how has it been? How has that aspect of your recovery been going?
So when I was in therapy, my counselor, I was having a really hard time just dealing with everything, as you can imagine. And so she told me to just start writing it down. So I started to write it really just as a journal. She said, just start writing your story from the beginning. And then when I was nearing the end, some 3 or 4 years later, she asked me what I thought about publishing it. And I laughed and I thought, why would I do that? I didn't imagine that I could ever do that. But she and I talked about that, and she said, I think a lot of people need to hear your story. And so I decided to publish it. So in 2015, I published it, and have had nothing but positive responses from it. People are often will reach out to me and thank me for sharing it because they thought they were alone. They thought they were the only ones that were feeling that way or doing those things. And so it's been really a wonderful journey to have shared that much and been so positively, so positive, had such positive feedback from it.
Yeah.
Excuse me, this has been a very interesting conversation. As someone just posted, we have never had this conversation with any medical professional in our country before, and we want to thank you for breaking the ice where that is concerned.
Yes.
And
hopefully someone else will hear this and want to open up about it, because as you say, it's something that addiction in general is not something people want to talk about, but especially I think for medical professionals it is equally, maybe, I don't know if it's the shame and the embarrassment associated with it that makes it difficult.
Yeah.
Yeah.
I could imagine, because as a medical professional you're looked upon as God, literally, and you can save someone's life. Mm-hmm. And so you're really supposed to not have any flaws, and that is not so. You all are human, and we expect that you all would make that wrong choice from time to time.
Right, we are most definitely human.
Yeah. And speaking of young people, we want to show you one of our young talent here in Trinidad and Tobago from the Civilian Conservation Corps, because we know young people experiencing an opioid crisis themselves. And I know when the news broke about the opioid crisis in America, how Americans dealt with that. So let me just show you this young lady here, the second place winner, and we'll speak about young people a bit when we return after this. So Shortman, you could put up that video of the second place entrant from the Civilian Conservation Corps Human Trafficking Spoken Word Competition. We promise them that we'll give them that final, as we observed. This week here was International Youth Day, so we had that competition put on by the Counter Trafficking Unit, and which the Civilian Conservation Corps participated. So Shortman, could we show that video now, please, of that second place?
What's Next by me, Jenny Macmillan from Central Region CCC. Back when I was effortlessly me, looking fixedly up to the blue, free as an unapologetic, unfettered bird, extending its wings to the blustery winds of the heavens, chanting her songs of never-ending freedom.
Untamed she sings, but deep down she longs for purpose.
An invigorating adventure like no other. The thought of life left me wide awake, wondering nervously to what awaits on this unpredictable pathway. A doctor's degree?
Or a chance to an opportunity of everlasting unity.
What's next? Just as I perceived, experiencing the charms of life, a taste of love and fondness. I was unwittingly drowning in the stupidity of enchantment, being submissive to the enticer, ignoring the advice of a mother who showers her words of good intentions.
But I am young.
I suppose, as ignorant as a determined soul. These words will be the last of the innocent, the bold.
What's next?
You see, the man I thought was my childhood dream was actually your plotting scheme, and now I see foolish me would think 6 weeks was eternity, although the words of my loving mother lingering through my state of delta. Take it easy. As the rain begins to fall on my skin, realization dripped in. I am a victim of trafficking.
Captivity? Am I not part of this humanity? What's next?
The scent of an unsavory whiff met my perception, awakening the tears of realistic aggression. Less able to say a word, vertiginous and intoxicated as a swaying serpent. At that moment, memories of innocence caught my attention, while the greed of power takes its uninformed consent possession. What's next?
Brutality?
What's next?
Materiality? What's next? Slavery? Humans are not for sale.
Yet so to the oppressors, you cold-hearted monsters, ignoring the tears of my tormented figures. Have you no shame to this unfair game? Please, I plead to be free, for the tears of a mother.
It falls to your destiny, yet you desire money. Have you no sister, no daughter?
Oh, mother, where is your dignity?
My dignity?
Oh, I see, you desire liberty. Free to do whatever you please.
Humans are not for sale.
Am I not part of this humanity? Am I not a human being? What's next for us?
Victims of captivity?
What's next?
What's next?
Please, what's next for me?
These are just some young people that the government has a program called the Civilian Conservation Corps that we're trying to keep on the right path. And as you know, there was an opioid crisis among young people right now. Tell us a bit about that. How is America dealing with that right now?
With youth and addiction?
Yes, and the opioids, especially with opioids.
Yeah, it certainly is a huge problem. But there is a lot of community work that reaches out to adolescents to raise awareness and to let them know where to go if they should encounter addiction issues. Part of the biggest problem that I see is access for young people. In particular, in medicine cabinets at their own homes, at their grandparents' homes, their friends. So I think it's really important to remind folks to, when they're done with their pain medications, to dispose of them properly, and so that the young folks don't have access to them. But they also need to know where they can go if they do develop a problem, or if they, find themselves seeking substances to deal with life. Hopefully, if we can, through the community and outreach and schools, let them know where to go and what to do should they run into those kind of problems. I think that would be really helpful. And I love those kids those young ones that are making those videos and helping to raise awareness of trafficking too, because that's a huge part of it.
Yes, it is. It is. And somebody had a question for you quickly.
Yes, we have a very good question here from Beverly, who is a friend of An Dependency and a recovering addict herself. She's asking, do you think a nurse with an addiction problem should continue working in the field while in recovery, considering that the environment, the workplace, may be a trigger?
That is an excellent question. For me personally, I do not work in a field where there's a lot of narcotics. So I used to be emergency room nurse. I don't do that anymore. I do behavioral health now. I certainly do have some access to some pain medications, not a whole lot, but some. I don't have cravings to use it. However, I just don't think it's smart for me to be around a lot of narcotics where I'm giving them out all the time. But everybody's different. I know plenty of nurses that have returned to their previous job and done very well. I've also known nurses that go back to their previous job and relapse. So it's something that people have to really stay on top of and know what their strengths are, what their weaknesses are, and what they can tolerate. I was in a program after I got my license back. I was in a program for 5 years where they were doing urine drug screens on me weekly, random. So I didn't know when I was having them. Yeah, wow. 5 years. Yeah, it was a very intense program, but it kept me sober. And, you know, it really gave me a solid base of recovery. So I was really grateful for that.
Right. So, Kristin, let's go to that first place winner now. You can see another young lady in action, again from the Civilian Conservation Corps, before we wrap up. So this is the first place winner. And as you said, it's important for us and have especially young people spreading in awareness and sharing information on human trafficking. So, Shortman, let's go to that first place winner now of the spoken word competition, Civilian Conservation Corps.
My name is Akela Cooper, and I am from the South Central region of the Civilian Conservation Corps, and my spoken word topic is Humans Are Not for Sale. This is not some Nancy story or fairy tale. Our humans are not for sale. Beaten, broken, and shackled for the use of their bodies, their cries for help was heard by nobody. A heart, a lung, an eyeball, a kidney, a live nut, they are going to skin me. They promised to take me to my destination, but instead they drug me. Where am I? In another nation. Age don't matter. They don't care if you're a baby. They sell your body and take your soul, as long as they have you under their control. Her body for their pleasure, while she screams in pain, they left her lifeless body shackled in chain. Skin to skin, she was tied to the floor. With not much strength left in her, she was beaten some more. Please, please, oh God, have mercy. Her screams were like water, which made them thirsty. Blank in her thoughts, while she sat there, feeling restricted. That white powder had her quite addicted. Wondering if there would be any law or any order. Soon her organs would be shipped across the border. A couple $1,000 to be another human being. This multi-billion-dollar industry is very much real. Don't even try to complain or explain your body like luggage for drugs such as cocaine in a house of bondage where there's darkness, no light, consumed by fear. It's hard to put up a fight. Someone who they trusted with their future and plans, someone who they thought would easily understand. Victim or not, your voice is heard. Let's bring awareness by spreading the word. Thank you.
Right. And that's the first place winner.
Akela Cooper from the South Central region of Civilian Conservation Corps. And as Garth mentioned, they all received their prizes last week and were very appreciative. And of course, we thank the Counter-Trafficking Unit and the IOM and others.
And the Franciscan
Institute for donating and contributing to the prizes for these young people who really did an excellent job in translating the themes and the topics and bringing it across in some very innovative ways. So congratulations to all of you again.
And folks, we still have Kristin on the line. Before we send, we thank her for.
So if you have any last minute questions,
yes, you
send
can,
them in.
or you can call her at 622-3937 if you just want to say hello to us, or you have a question or two. So Kristin, it's been, as you said, that you're experiencing a second wave now of this pandemic, and you guys are hanging in there and coping. How is the vaccine rollout going as well in your neck of the woods?
It's going okay. We have about 50% fully vaccinated now in Wisconsin. I think that's close to what it is the rest of the country.
Right.
I think 50% for one shot at least.
Okay.
But it's been a struggle, really, to get more folks to get vaccinated. My family and I are vaccinated. I encourage people to get vaccinated. It's the best defense we have right now against COVID.
Do you have a lot of, and you have a lot of hesitancy as well? Still?
Yes, absolutely. We do. People are afraid, and other folks don't want to be told what to do, I guess. In the U.S., we're very, hard-headed, independent folks. I don't know. Sometimes I think that's more selfish than anything else. I think we need to be thinking about each other and doing what we can to protect each other. And the vaccine has been given to, I think, over 1 billion people now,
yes.
and has been safe. Certainly, people have reactions, but that percentage is minuscule. It has been really profoundly safe, and highly recommend folks to get vaccinated.
All right, folks. Well, Kristin, we want to thank you very, very much for spending your Sunday evening with us. We thank your family for allowing you to spend this time with us here this evening.
Yes.
We really, really appreciate it, and we wish you all the best going forward in your sobriety and, dealing with your, how for you to cope, continue to cope, and your recovery to be successful, continued success with it. We really appreciate you.
Indeed.
Thank you. And thank you for letting me be on and share my story, for raising awareness. Your show is just a delight. So thank you for letting me participate.
Thank you so much.
Welcome.
Thank you so much. And you can
please keep in touch.
Keep in touch, and you can share our information with your colleagues out there as well. They can join us any Sunday they have the time.
All right.
Sounds good. Thank you. Take care, both of you.
Okay, you too, Kristin. Thank you very much. Good night.
Thank you.
Bye-bye. Well,
Bye-bye.
folks, that was Kristin Waite-Labott out there in Wisconsin sharing her story with us. And before we wrap up, I want to also share with you the Trinidad and Tobago Armed Forces Veterans Association. They have a barbecue as well on Saturday, August 28th. It's a 59th anniversary Independence lunch, as they call it. So you have a variety of stuff. Soldiers, they can cook. They love to cook, they love to eat. So you can get your fair share of chicken, fish, pork, saffron rice, green salad, stewed pigeon peas, all of these things. You can, and on that day you can check them at in Chamflair, the Hearty Foods car park in Arima, and also in Hearty Foods car park in Arima. And they also have delivery as well. So you get in contact with Trinidad and Tobago Armed Forces Veterans Association. Support their barbecue, all you veterans out there, Defense Force veterans. Remember, this barbecue is on Saturday 28th, and you can catch them at the Mount Door or Chamflair at Hearty Foods at 22 Mount Door Road, Chamflair. Let me get that right. 22 Mount Door Road, Chamflair, or Hearty Foods car park, Arima, on that same day. So you go out and support them, and remember your veterans as well. That Zoom meeting with Dr. Jennifer Rouse, that will be on Wednesday, 18 August from 15:45 hours. Please join the meeting.
The Tesses come out.
Yes.
Join the meeting.
And share the word around.
Yes.
And remember as well, they have a meeting every Wednesday from 1000 hours to 2000 hours. It's a marathon chat with veterans. And you can find all of that on the Trinidad and Tobago Armed Forces Veterans page.
On Facebook?
Yes, and of course they have a chat group as well. So
a WhatsApp group.
Yes, they have a WhatsApp group, so you can actually hook up with the guys or call my boy Winston MS Nurse. Let me give all the Mr. Nurse number so they could call or ring down your phone. Mr. Nurse's number is 680-8345. Call him for barbecue tickets to find out when is the Zoom meeting again, when all these things. Call Mr. Nurse now, 680-8345. Short man, you can put up that last image to the image we have for the winners from Ministry of National Security. Also, I'd like to extend condolences to the passing of Steve L.T. Richards.
Yes.
As you know, Steve Richards was a stalwart, took over after Tambi at Rebirth House and continued that journey. Well, Steve Richards is no longer with us, and we say condolences to his family. And LT will be surely missed. On the screen now you see Miss Wheeler and yours truly giving all the prizes to the Conservation Corps winners. We also lost Kelvin Biraza, KB. He lives out in the States. Also, you may know him, was an excellent sportsman in the Trinidad and Tobago Defense Force. Well, he passed away. Quentin Cole, who was an instructor at Civilian Conservation Corps after he retired, he too passed away last week. And Ronald Wires Williams, we lost him as well. So a lot of people went home in the past couple of weeks, like we're about to do now, but to our home.
Yes. Yeah, so on the screen now you're seeing the all of the winners, second and first place winners.
Yes, and
collecting their prizes.
Received their prizes at the Counter Trafficking Unit office. Hey, to you loyal fans, loyal listeners, loyal followers, we thank you once again
We
for
appreciate you.
Yes, we appreciate you. We really do. Thanks a lot. And we're looking forward to our 20th anniversary celebration next year with you all. So, that's something to look forward to, because you all have been really, really with us, Annette Maguire, and well, we don't hear from Yvonne and so again, or Kathy and those folks, but I know they still listen. And those of you with it. And this evening on TV6, folks, Natasha?
This evening on TV6, episode 3 of the Eye on Health series, featuring, the topic is mental health and well-being. This is a very important subject, featuring Caroline Ravello, another friend of Eye on Dependency, and Ashwini Babal from the Mental Health Unit at the Ministry of Health. They're talking about mental health and well-being. Caroline shares her own personal story with mental illness, and I want you to listen very attentively to what she has to say, because she mentioned some things that are relevant, even though this was recorded in 2019. What she has to say is still relevant in 2021.
Yeah.
So,
and she used a word that is very,
it's being bandied about
today.
very frequently.
Yes,
but it does have relevance not only with COVID, but with mental ill health as well. So, a very interesting episode this evening from 8:30 on TV6 and 8:45 on the Eye on Dependency YouTube channel.
You don't want to miss that, folks. Caroline, very good at what she does, and with sharing information on mental ill health. So once again, God bless all of you. Thank you for your continued support. And remember, there's a new variant in town. New kid in town. Please, what we see instill with some of you, please. We can't beg you enough. Please.
Stay home, mask up, sanitize, distance.
Please, take care. Be safe. Good night.
You're listening to Eye on Dependency with Garth and Natasha. Reality radio at its best. This is I-95.5 FM, TNT's most